The first thing that you're probably looking for when you're trying to evaluate if a conservative care provider is doing what's appropriate for you is how much time they spend in their initial exam and how much they really go into kind of like fringe diagnostic tools. So there's a lot of stuff out there, and sometimes when you get into the conservative care world, you start getting into real dicey diagnostic tests. If you start seeing that kind of stuff, I would probably avoid it. When you get a provider that really knows what they're doing, they're going to do a standard exam. You should get a neurological exam, an orthopedic exam. They should watch you walk. They should watch you squat and how you move around. They should be asking you tons of questions. The exam should take at least 45 minutes to an hour. And then when they're done with the exam, they should explain it to you. What happened? Why did your test become negative here? And why did it hurt when you did that? And they should explain everything to you. And it should be clear. It should not be something that's confusing. The body's not very hard to understand. And if somebody explains it to you, it's very easy to understand what's happening. Muscles are muscles, bones are bones, joints are joints. It's not rocket science. You just need somebody who knows what tests to do and how to stress them in certain ways, and then be able to explain it to you in an easy way. And you should feel confident leaving the office that that person knew what they were talking about. You should get results right away. If I test somebody and I give them maybe a shoulder exam, right? They say that their shoulder's hurting, and I test their shoulder and I figure out exactly what's causing their problem, I should be able to treat it that day, redo the test, and their pain should go away. Now, that might not be a long-term solution. You might not like miraculously cure it like Mr. Miyagi in one visit, but you should know immediately like, hey, this person got it right. They gave me a little bit of treatment. I feel a little bit better, and I should expect to continue to get better over the course of a treatment plan. I just need to know what that treatment plan is going to be, and then they should explain it to you. And not everybody should get the same treatment plan. If you come in with a shoulder problem and somebody else comes in with a shoulder problem, they should get two totally separate treatment plans, because every shoulder is unique, every low back pain is unique, every hip pain is unique, and you have to customize it to the person in front of you. If you're getting like a blanket sheet of paper that everybody gets and everyone gets the same amount of visits and everybody gets the same price, I would avoid those kind of providers. If you're suffering from pain, first of all, you have to understand pain's not okay. That's not a normal thing that happens in your body. When you're in pain, that's your body telling you that something's wrong. You need to do something about it. So we're here to help with stuff like that. We're here to make sure that you get an accurate exam, that you get an accurate idea of exactly what's happening, what specific tissue is the pain generating tissue, how to come up with an accurate solution that's going to be a long-term solution. And if you want something like that, you're tired of being in pain, you don't want to take ibuprofen anymore, you're tired of the rigmarole and bounce around to different doctors, you got to come to our office. We'll get the exam done. We'll get you the treatment that you need. All you gotta do is click the link in the description here. You'll fill out a little form. You look at a time slot that's available for us. We'll come in, do the exam. We spend 45 minutes to an hour with you. We do a full orthopedic exam, neurological exam. We do functional tests. Bring your x-rays, bring your MRIs, bring all your lab work in. We'll take a look at everything. We'll do a full comprehensive exam. You'll get treatment that day too. And you'll know right away, as soon as you're done the first visit, you'll know if this is gonna be something that's gonna work. You should feel better almost instantaneously. You should feel at least some sort of change. And then we'll decide on how many visits is it gonna take, how many times a week do you need to come in, what's your insurance gonna cover. That all depends on how you respond from the first visit and what your diagnosis is. So we'll make sure you get an accurate diagnosis. We'll check your insurance benefits. We'll see how many visits it's gonna take, and we'll get you fixed up.